This podcast reflects the personal opinions of the participants and should not be taken as medical advice. The available information on the COVID-19 pandemic is constantly evolving, and some of the data, statistics, and opinions on this podcast may be obsolete by the time this is available for listening. Please visit the CDC or WHO websites or contact your local health department for up-to-date information and recommendations. Thank you for listening.
We're moving into uncharted territory.
Millions of students will now have to stay home.
The financial markets in free fall.
A nation on edge as efforts to contain a global pandemic grind public life to a halt.
Welcome back to the Corona Pandemic Podcast. This is Pastor Christopher Mantei. On the same road as you are, friends. We are indeed all in this together, and this pandemic continues to affect every sphere and strata of life, and we are just so blessed to be able to be talking to a doctor, an ER doctor, on the front lines of this war. Really, that's what it is for our health. And he's a Christian, a strong Christian, a mature believer, and so the purpose of this podcast, as always, is to inform the general public and also the Church of Jesus Christ how to best address what's happening and to get the real facts. This is a source you can trust, friends. This is not spin, media manipulation, scare tactics, fear-mongering, or trying to appease a political party or person. This is only about the truth, and of course the ultimate truth is Jesus himself, and he is coming again. And so how do we look and live in light of what's happening in every nation around the world, and especially in Western nations who are very wealthy and are not used to being uncomfortable and dealing with things like this COVID-19 situation. So as always, we welcome you from wherever you are. Thank you for tuning into this podcast. And as always, you can go to coronapandemicpodcast.com for all the episodes of this program, as well as a link to support the program, because we could sure use it to keep us on the air and to spread it far and wide. So whether you're listening via Apple Podcasts or Spreaker or wherever else, Google Podcasts, welcome. We'd love to hear from you. By the way, there's a contact form as well on the podcast website if you want to reach out for any reason or just wanted to pray for something, or maybe you had a question for Dr. Hata. Please use that or join our Facebook group that's established specifically for questions. So please go there and utilize that. And so we want to get right to Dr. Hata today. We just talked this morning, and there are some staggering new numbers as far as a death toll projection that's based on, if we do everything right, it's still very, very high. And we're starting to hear about certain treatments and certain folks about, why isn't this drug being used and it's working, or is it really, and what kind of evidence do we have that it will be effective, etc. So Dr. Hata is going to talk about all that. And then finally, as believers, how do we apply the Beatitudes to this situation? When Jesus talked about what we call the Sermon on the Mount, very famous passage of the Bible, when he would talk about blessed are these folks, and blessed are you if you do this, and blessed are these. Blessed are those who mourn is one of them. And so we should not be afraid to do that. So again, Pastor Mantei here welcoming you along for the ride, because we truly are in this thing together. So right now, let's get right to the talk that we've had today with Dr. Ryan Hata. And again, send in your questions, comments, or thoughts, and we will get right to them next week. But for now, here's Dr. Hata. We're going to start talking about this incredible 100,000, 200,000 or more number. And we are back. Dr. Ryan Hata is joining us once again. Dr. Hata, thank you so much, my friend, for doing this. I know you're in the middle of this battle out there. First and foremost, let's address the elephant in the room, which is this huge, all of a sudden, these huge numbers of potentially dead people, specifically in America, of course, because that's what gets the most attention. We're hearing 100,000 and up, maybe 250,000 folks. What do we make of that? Do you think that's accurate? What are you seeing?
Well, hi, Chris. Thank you again for having me on. Yeah, those numbers were shocking, and they were not entirely unexpected, but certainly were shocking. The latest numbers that I heard were 100 to 240,000 dead in the United States alone, which is a very large number. Obviously, this would be one of the largest human catastrophes that this country has ever seen, certainly within the last 100 years. Those numbers, from what I understand, were obtained using what would be considered some of the most robust modeling algorithms out there. The epidemiologists, I'm sure, have looked at this ad nauseum. They've looked at it very thoroughly. I've heard other numbers from some other institutions, specifically in Washington. I believe it was the University of Washington, although don't quote me on that, that had numbers closer to 80 to 100,000. But still, that number is very large when you compare it to other large catastrophic events in the United States within a similar time frame. That is very large, and it does certainly threaten not only the healthcare system, but in some capacity the very fabric of the society in which we live. And so we need to really understand that this is a very serious process right now, and I think that certainly has sunk in and hit home with many people around the country, as we are seeing more and more states and more municipalities and localities starting to shut down non-essential travel, non-essential businesses in anticipation of what could be a very large human catastrophe.
On a side note to that, we all know governors basically are driving this train as far as, who shut down and for how long, et cetera. What would Governor Hata do?
Well, Governor Hata would not do too much different than what a lot of the other places are doing. And this is one of the big debates that we're seeing. And it's a good debate. It's a robust debate. It's an interesting debate because it really looks at our society as something fairly unique. When I look at the whole country, I don't see a uniform country. We have a very heterogeneous population, and the different areas are going to have to handle this differently. In New York, I think having a lockdown, a real true lockdown, is going to be absolutely necessary, because you cannot, in a population like New York, in a city like New York, have people that live literally on top of each other in 100-story high rises as far as the eye can see. You can't have people of that a population of that density running around, because it will spread like wildfire, and you will just see an absolute overwhelming of the system, not just the healthcare system, but of the entire fabric of the society there. So a lockdown does have to occur. And from the images that I've seen, of course, that we've all seen in New York City, I think that is absolutely the appropriate thing to get a handle on this. In smaller areas, and I have some colleagues and friends in some of the really remote areas of the country, and the Dakotas and other places, they're not seeing it. They're really not seeing very many cases, if any cases at all. And some of them don't really have much experience with it at this point. And do their entire communities need to be shut down? Well, that would be something that their local authorities would have to get a handle on. So it depends on where you are in terms of being a governor. If your state has a widely dispersed population, I think that you could potentially relax some of the measures in terms of really severe restrictions. I think you could relax some of the restrictions, but in densely populated areas, I think you'd need to have fairly severe restrictions.
Yeah, it would depend, wouldn't it? Okay, so now that we're looking at this, hopefully a lot of folks are waking up to the fact that this is for real and it can really affect you and your family potentially. And it's not even that predictable as far as, it's only old people, or it's only somebody who's already sick, because now we're seeing this spread out to different demographics and even younger. children and things. So everyone, of course, turns to, okay, then how do I treat this? What are the treatments like? We've heard the names of these drugs, even from the White House, and from every circle, somebody's got an opinion on what'll work and et cetera. What are you hearing about? What is something effective yet? What should people be thinking and planning on as far as the treatment if they are diagnosed?
Well, this is a great question. And I'm sorry for the bells in the background. Where I live in our community, our governor has asked us to ring bells at 10 o'clock in the morning for those victims of the COVID disease that have actually passed away. And so I'm sorry I set my alarm for that. And
Really? Oh, look at that. That's awesome.
So that was not just some random alarm or bells. That was for a purpose. But anyway, that's a great question. The treatment options out there are extremely limited. And you're hearing more and more about this. And in fact, one of the more recent presidential press conferences, Donald Trump certainly touted and seemed very hopeful about certain treatments that were being used in other areas of the world, specifically in France and in China. And they were looking at these treatment options with optimism, and I would look at it that way as well. I mean, you always want to go into the equation with some hope and optimism, or else why else would you want to do it? But the main things that I would caution people about are that these treatments are not proven yet. They really are not. From a medical perspective, we have to, when we look at a treatment plan for somebody, whether it's a surgical intervention, whether it's a medical intervention, whether it's some non-surgical or non-medical other type of intervention, like a lifestyle intervention, we have to look not only at the science behind it, but also the outcome behind it. And what I mean by that is, does this particular treatment, whatever it would be, does it actually, one, improve morbidity or decrease the complications from the disease? And does it improve mortality, which is to improve the death rate? So several of these medications have empiric evidence behind them. They don't have very strong evidence that would suggest that they improve morbidity or mortality in COVID-19. Now, that being said, the empiric evidence is very reassuring. It is very good. But when you look at a medication or some type of intervention, really the gold standard would be a prospective double-blinded placebo-controlled trial where you would have a treatment intervention arm and a non-treatment intervention arm that would basically be running parallel to each other, and you would look at the data as you went forward. And they would be controlled and blinded by the researchers, and they'd be controlled through placebo to control for placebo effect. And those type of studies, especially large studies over multiple medical centers and multiple academic institutions, can take quite a bit of time because you have to have patient enrollment and so on and so forth. And then you have to actually look at the data and then run your statistical analysis to decide whether or not that data is actually true or how robust the data is. So right now, there really are no clear studies that show that these particular interventions, such as hydroxychloroquine, chloroquine, azithromycin, remdesivir, there are several medications that are on the table right now that are being tested. There are not any clear, robust studies to show that they are beneficial. That being said, again, there are anecdotal cases and some anecdotal studies that have looked at some of these things and do show some improvement in outcomes, as well as from a scientific, more basic science perspective, they decrease viral load and so on and so forth. So one of the practicalities behind that is that people are now wanting to get treatment without really understanding the risks of that or whether or not this is going to be effective. And so you have seen in certain states, actually, the governors or the medical boards issuing statements to physicians and to healthcare practitioners and to hospitals saying, do not use these medications. In fact, I saw a story in New York where the governor had said he did not want these medications to be used. Now, I don't know if that has been lifted by the time this podcast comes out. It might be lifted. I'm not entirely sure. But I know that these medications are being used empirically. And from case studies and reports, they are successful. But how true those are, and when you weigh those against the potential risks, because many of these medicines do have significant risks associated with them. They're not entirely benign. In fact, in one case that I read, there were several people in Nigeria. I think it was in Nigeria, but I'm sure it was somewhere in Africa. They were taking this chloroquine medication, which is an anti-malarial drug, in trying to prevent the COVID-19, where they didn't even have COVID-19, and they took some of this medication, and the report was that several of them actually died from it. So there are some concerns that these medicines do have toxicities associated with them, and so the risks and the benefits have not been weighed yet. We don't know what those are. And so I caution people against being I don't want to say overly optimistic, but I would caution people against jumping to conclusions and saying that we need to throw these medicines out there because there are not only safety issues behind them, but there are also logistical issues, as these are in limited supply. These are not, we don't have an infinite number of these medications, and they are used for other legitimate purposes. So you don't want to burn through an entire quantity of these medicines and then not have them available for other conditions for which they're already recommended and established.
Right. And that goes along with this whole impatience that we have as a society, doesn't it? Like, I want it and I want it now. I'm, as a pastorally, I'm concerned about when folks are had enough of staying in their house, because that's going to happen eventually. 2 weeks, 3 weeks, okay, no problem. But we're talking a month, and who knows how much longer. People are going to just start venture out and go say, I got to go work or what have you, or I got to get this medicine, I'm going to get it myself type of situation. That's what I'm concerned about. I'm praying into that. So let's, again, as a Christian, as a believer who's actually treating folks with this, and you're hearing these numbers, and you're hearing about potential treatments, but you don't want to do anyone wrong, obviously, or harm them, both as a doctor and as a Christian. You never want to do that. How is this going to affect us as a body? How should we kind of bring this up every episode, but we should, I guess. How should we as the body of Christ be thinking about and acting and praying into these things? And what should our response be? Has Jesus referred to these things? What is your take at seeing it and then obviously knowing the Lord?
Yeah, I completely agree with you on the first point there of people getting antsy. I think everybody is. I mean, I am. I know, people that I know that have been in essential lockdown for the past 2 weeks now, going on 3 weeks. We're getting a little bit antsy. I mean, I would like to go out to dinner every now and then, but that's not going to happen, and I think that's okay. But yes, I worry about it on a societal level, certainly, and I think that we need to be very cautious about that. And I think that's one of the reasons why some of the leaders have floated the idea of getting, the economy back up and running and so forth. And I would never say that we should put money over human life, but at the same time, there are a lot of things that people need to do. We're not created to be in isolation all the time. That is certainly something that is clear with the human condition, is that we are not created to be in isolation all the time. And so this type of isolationism is very, very tough. So as a person, just as a human, not even as a physician or whatever, but as a person and also as a follower of Jesus, there are several things that come to me and I think about in this situation. And one of them is being a good neighbor. And, Jesus clearly taught that the two greatest commandments were to love God with all your heart, mind, strength, and soul, and to love your neighbor as yourself. And those fulfill the law and the prophets, the entirety of the law and the prophets hang from those two concepts, those two commandments. And we often look at loving God, but let's look at loving our neighbor. This is a real opportunity where we have to love our neighbor. One of the most tragic things that I've seen in the hospital, and having done this now for many years, we see tragedy quite frequently in the emergency department. But one of the most tragic things and I've read these cases across the world in similar situations and people with this particular pandemic, is that people are being diagnosed with a devastating disease, not necessarily COVID-19, but cancers and heart attacks and strokes, and they're alone because the hospitals, because of the necessity of trying to keep this pandemic under control, the hospitals are often not letting visitors come back. These are hospital policies that are very well thought out. Our administrators and our hospital leaders have really, our physician leaders have really thought about how to best approach this. And one of the things that we have to do is try and keep people out of the hospital that don't need to be there, because the hospital can turn into a hotspot for transmission of the disease because it's a fairly close environment. And there are a lot of sick people there, and there are a lot of immunocompromised people there, and there are a lot of healthcare workers there. So one of these things that you've seen across the country is that hospitals are saying no visitors, or extremely limited visitors. And, as a patient, that's extremely challenging. I mean, what happens when you go into labor and you can't have any visitors? That mother, that single mother can't have any visitors because the hospital is shutting down, or they can only have one, and they have to choose between their mother and maybe the father or a friend, and they can only have one visitor, and that visitor can't come in and out of the hospital. What happens if you have had a stroke and you now have limited mobility and no one can come visit you, or you're diagnosed with a devastating cancer and you have to cry in the room alone? And I don't say that lightly. I've seen it. It's very, very sad. It's actually one of the most tragic things I've seen in this situation. So as believers, we need to understand that we are in a very unique position to mourn with our neighbors. So it's a unique position to be the neighbor that God has called us to be. But also, when you look especially at the Beatitudes and the Sermon on the Mount, what did the Lord call us to? He said, "Blessed are the poor in spirit, for theirs is the kingdom of heaven. Blessed are those who mourn, for they shall be comforted. Blessed are the meek, for they shall inherit the earth. And blessed are those who hunger and thirst for righteousness, for they will be satisfied. Blessed are the merciful, for they will receive mercy. And blessed are the pure in heart, for they shall see God. Blessed are the peacemakers, for they shall be called sons of God." So these Beatitudes, these attitudes that we as believers should be having, and I pray that would be refined in us, these can be practiced in a very, very unique way, because not only are the patients in the hospital suffering, but their families outside of the hospital are suffering. That's something that is often overlooked. If your wife or your mother or your father or son were diagnosed with a devastating illness and you couldn't see them and you couldn't hold their hand and you couldn't hug them, and you're alone at home hearing this over the phone, that's tough. It's a really, really tough thing. So my prayer for the body would be that this is a truly unique time in history. And as these numbers that are being projected by the federal government and other institutions, as if these numbers come to be 100 to 240,000 dead Americans, we are going to have ample time to mourn. We're going to have ample time to mourn. We're going to have ample opportunity to mourn. And so we need to be that part of the body. This is the reaction that we need to have, rather than any type of, heaven forbid, finger pointing or rebellious spirit. I know that, and I don't want to speak too much to this, but I know there has been a fairly rebellious spirit amongst some believers that, you're not going to tell me what to do. Right. I'm going to have this, I'm going to, do what I want to do. And I'm not going to follow it, follow the rules or whatever. Well, social distancing is not against the commandments of God per se. So, we have to be very, very cautious about that, the scriptures do say that God put government's in place for certain reasons and at certain times for certain reasons.
Right. And, a lot of folks are maybe seeing this as a persecution situation. I'm really trying to nip that in the bud and say, guys, it's not. It might be in the future, but it's not now. Certainly, this is a health situation, and everyone's getting the same advice and the same treatment, no matter what you believe or don't believe. No one's singling you out for your faith. So, just put your mind at ease on that, and let's be about, as you say, ministering to all these pains and sufferings that are happening in death and mourning, and we can really rise up to the challenge if we're of the right spirit. So I completely agree with you, Doctor. So good. This is a great launching point here, my friend. Let us take to the heavens in our prayer life and be willing to walk it out. And you're certainly doing that in these emergency rooms where you are. So would you have a prayer request? What to folks listening today? How should they be praying from your point of view?
I think that at this point we need to be praying for patience. I really do. I think that, as you had said earlier, people are getting antsy. Their lives are being shaken in ways that they really had never anticipated. I think we need to be praying for not only patience, but for our lives to be poured out in a way that is sacrificial, because that's what God has called us to. That's what Jesus called us to do, is to love our neighbor as ourselves. And love has no greater expression than to lay one's life down for their friend, for their neighbor, for their brother and sister. And that doesn't necessarily mean just our believer friends, but also for those that are suffering, such as in the Good Samaritan parable. So we need to be praying for patience and for a spirit of peace through the chaos, and how we can be used as the neighbor that God wants us to be used as.
Amen. Dr. Ryan Hata, bless you, my friend. Until the next time, we say the Lord be with you, and thank you for being who you are and doing what you're doing.
All right. Thank you. Thank you, Chris. You take care.
For previous episodes and to support this podcast, please go to coronapandemicpodcast.com.